MACRA's law, it was passed to solve a problem. The problem was called sustainable growth rate. So this was a law that was passed to basically substitute for that SGR, sustainable growth rate problem, with a new payment regime by Medicare for doctors. This new payment system is actually a choice. It offers physicians the chance to choose between two pathways for the way they get paid. One is called the merit-based incentive payment system, MIPS, and the other is to join an alternative payment model like an accountable care organization. The doctor who chooses the first, the MIPS option, will have a number of things measured about his or her performance, quality, the cost of their care, their involvement in improvement efforts, their conformance to science-based practice, and their pay will actually vary depending on their scores on that performance system. If they choose to go with an alternative payment method, like join an ACO, then the organization that they've joined acquires that responsibility for working with them on improvement, and they get incentives to be there. In fact, the incentives to be in the alternative payment model are higher than the incentives you can earn under the MIPS system. So it's a new way to pay doctors. It's part of the big expedition we're on in the country to move toward value-based care at the physician level. My hope is that it stimulates and supports what we all want to do, which is the continual improvement of care. I'm not particularly a fan of carrots and sticks. I don't think that's the best way to enlist the hearts and minds of the workforce. But hopefully, under this payment scheme, we can get more toward hearts and minds now and say, how do we get better? It's morally correct, it's professionally diligent, and now it's also related to economics.